Hello, gentlemen, and welcome. Did you know there's a medication that can increase your testosterone naturally by more than 100%? It's affordable, widely available, and can lead to dramatic improvements in your energy, mood, sleep, and yes, your erectile function. I'm talking about clomiphene, a well-established treatment that has been helping men restore their vitality for decades. But here's what I've found. Most men have never heard of it, and those who have often don't know the full picture. Today, I'm going to walk you through everything you need to know about this powerful option, who should consider it, who should avoid it, proper dosing, realistic results, and the side effects that aren't discussed enough. I'm Dr. Raina Malik, and welcome to Medical Facts, where we explore the honest science behind men's health. Now, before we begin, I need to be very clear. This video is for educational purposes only. I will share what the research says and what clinical experience has shown, but you absolutely must consult with your own physician before starting any medication, including clomiphene. What I provide today is knowledge, so you can have an informed, intelligent conversation with your doctor. This is not a prescription, nor is it personal medical advice. It is education. Your doctor knows your history, your current medications, and your individual risks. Always work with a healthcare professional. Understood? Good. Let's continue. So why am I so passionate about discussing clomiphene? Because in my practice, I've seen too many men suffering quietly, believing their only choices are costly testosterone injections, which can shut down your body's own production, or simply accepting decline as inevitable. Clomiphene offers another path. Studies indicate it can raise testosterone levels from, say, 250 nanograms per deciliter up to 550 or higher. That's more than a doubling in some cases. And when your testosterone rises naturally, many other things follow. You wake up with energy instead of dragging yourself out of bed. Your mood stabilizes, you sleep more deeply, your confidence returns, and yes, sexual function often improves. We're talking about the return of morning erections, a stronger libido, better performance. This isn't magic, gentlemen. It's biology working as it should. Now, I'd love to hear from you. If you're finding this useful, consider subscribing to Medical Facts and hitting the notification bell. We're here to give you science-backed information you can actually use. And drop a comment below with your age and where you're watching from. Are you experiencing low testosterone symptoms right now? Fatigue, brain fog, low sex drive? Let me know, because community insights help everyone. If you're new here, welcome. Every week, we dive deep into topics that matter for your health after 55. Let's explore what clomiphene can truly do for you, because the benefits extend far beyond a number on a lab report. When researchers studied men with low testosterone who took clomiphene, they observed something remarkable. Testosterone increased by an average of 200 to 300 nanograms per deciliter, with some men seeing jumps as high as 571. That's not a minor bump. That can be a life-changing shift. It's the difference between feeling like you're dragging a weight all day and having the energy to exercise, play with your grandchildren, or simply feel like yourself again. And here's the key advantage. Unlike traditional testosterone replacement, clomiphene doesn't shut down your body's natural production. It stimulates it. Your testicles continue working, your sperm count often stays healthy or even improves, and you aren't dependent on lifelong weekly injections. Now, let's talk about energy and mood, because this is where many men notice the difference first. Low testosterone doesn't just cause fatigue, it can flatten you. You lose motivation, feel irritable, and stop caring about things you once loved. When your testosterone returns to a healthy range, it's as if the lights come back on. You wake feeling rested, not groggy. Mental clarity improves, lifting that brain fog. Your mood stabilizes. You're more patient, engaged, and present. One study following men on clomiphene for 12 weeks found significant improvements in self-reported energy and overall well-being. This isn't a placebo effect, it's your hormones returning to where they should be. And then there's sexual function, which, let's be honest, is why many of you clicked. Here's the truth. Testosterone is the foundation of male sexual health. When it's low, everything suffers. Libido declines, erections become unreliable, and desire fades. Clomiphene addresses this at the root by boosting your natural testosterone production. Research shows men on clomiphene report improvements in libido, erectile function, and overall sexual satisfaction. We're talking about the return of morning erections, spontaneous desire, and the confidence that comes from knowing your body is functioning properly. It's not an instant fix like some medications, but it targets the underlying hormonal issue, which can lead to deeper, more sustainable results. Sleep is another profound benefit that deserves more attention. There's a bidirectional relationship between testosterone and sleep. Low testosterone disrupts sleep, and poor sleep lowers testosterone further. A vicious cycle. When testosterone is boosted with clomiphene, many men report falling asleep faster, staying asleep through the night, and waking feeling refreshed. Better sleep means better recovery, better cognitive function, and yes, better sexual function as well. Your body produces much of its testosterone during deep sleep, so improving sleep creates a positive feedback loop that supports healthy hormones naturally. Finally, clomiphene can preserve fertility, a major advantage over traditional testosterone replacement. When you inject testosterone directly, your brain senses high levels and stops signaling your testicles. Over time, testicles can shrink and sperm production may drop to near zero. If you wish to have children or keep that option open, this is a serious concern. Clomiphene works differently. It gently prompts your brain to send more signals to your testicles to produce both testosterone and sperm. That's why studies show men on clomiphene often see their sperm counts increase, not decrease. If you want to optimize testosterone while preserving fertility, clomiphene is one of the most effective options available. It's affordable, it works with your body, not against it, and for the right candidate, it can be transformative. To make sure you're getting the full picture, stick with me to the end. We're going to cover exactly how it works, who should avoid it, and a practical checklist for discussing it with your doctor. But first, if you know someone who might benefit from this information, please share this video. Spreading knowledge is how we build a healthier community. Now, let's get into the science of how clomiphene works, because understanding this will help you have a smarter conversation with your doctor. Don't worry, I'll explain in plain language. Clomiphene is what's called a SERM, a selective estrogen receptor modulator. Estrogen is often thought of as a female hormone, but men have it too in smaller amounts. Your body converts some testosterone into estrogen via an enzyme called aromatase. Estrogen plays important roles in men, including in bone health, brain function, and sexual health. Here's where it gets interesting. Clomiphene blocks estrogen receptors in specific tissues, particularly in your brain, in an area called the hypothalamus. When clomiphene blocks those receptors, your brain perceives a lack of estrogen. Since estrogen in men derives from testosterone, your brain interprets this as a signal that testosterone is low, even if it isn't. This triggers the hypothalamus to release more gonadotropin-releasing hormone, or GnRH. GnRH travels to the pituitary gland, your hormonal command center, instructing it to release two key hormones, LH, luteinizing hormone, and FSH, follicle-stimulating hormone. These messengers travel through your bloodstream to your testicles. LH stimulates Leydig cells to produce more testosterone. FSH stimulates Sertoli cells to support sperm production. So clomiphene creates a cascade. It blocks estrogen signaling in the brain. Your brain amplifies the signal to produce more hormones, and your testicles respond by making more testosterone and sperm. This is why it's fundamentally different from testosterone replacement therapy. You're working with your body's natural feedback system. Historically, this was an unexpected discovery. Clomiphene was developed in the 1950s, and scientists initially thought it might work as a male contraceptive by lowering testosterone and sperm production. But when tested, the opposite occurred. Testosterone and sperm counts rose. Researchers had accidentally found a testosterone booster. Since then, clomiphene has been studied for men with hypogonadism, particularly secondary hypogonadism, where the testicles are functional, but the brain isn't sending strong enough signals. So what's a realistic timeline if you start clomiphene? Many expect instant results and get discouraged. Here's what research indicates. In the first 2 to 4 weeks, your testosterone levels begin to climb, but you may not feel different yet. Your body is adjusting. By weeks 6 to 8, most men start noticing changes, improved energy, stabilized mood, the return of morning erections, and increased libido. By week 12, you should be at or near your peak response, with blood tests showing significant increases in testosterone, LH, and FSH. Response varies based on your biology, age, baseline levels, and testicular function. The key point is that clomiphene turns up the volume on your body's own production system. It's elegant, and under medical supervision can be very effective. Now, let's get clear on who is a good candidate and who should avoid clomiphene, because it isn't for everyone. The ideal candidate has secondary hypogonadism, healthy testicles that aren't receiving strong enough signals from the brain. This can be age-related or due to stress, obesity, or other factors. Blood tests would show low testosterone, but normal or low LH and FSH. Your doctor can determine this with simple labs. Men over 55 can certainly benefit, though response can be more variable because testicular function naturally declines with age. It's worth a supervised trial, but manage expectations. On the other hand, if you have primary hypogonadism, meaning your testicles are damaged or non-functional, clomiphene likely won't work. In that case, testosterone replacement therapy is usually the better path. Now, who should avoid clomiphene? If you have liver disease, as this medication is metabolized by the liver. If you have a history of blood clots, stroke, or serious cardiovascular issues, discuss this carefully with your cardiologist. If you have vision problems, particularly retinal issues, clomiphene can cause visual disturbances like blurriness, light sensitivity, or floaters, which may worsen pre-existing conditions. Usually these resolve when stopping the medication, but it's a serious consideration. Another critical point, if you have depression or mood disorders, proceed with caution. Clomiphene affects estrogen signaling in the brain, and estrogen helps regulate mood. Some men feel wonderful on it, others experience increased irritability, anxiety, or emotional sensitivity. It's unpredictable. If you have a mental health history, you and your doctor must monitor this closely. It doesn't mean you can't try it, but awareness and a plan are essential. Before starting, your doctor should order a complete hormone panel, total testosterone, free testosterone, LH, FSH, estradiol, and prolactin. Also include liver function tests, a complete blood count, and a lipid panel. If you're over 50, a PSA test for prostate screening is wise. These provide a baseline and show whether clomiphene is appropriate. Don't skip this step. Navigating hormones without data is risky. You need monitoring and a doctor who understands how to interpret your results. Let's discuss dosing, because getting this right is crucial. The most common starting dose is 25 milligrams every other day, or 50 milligrams 3 times per week. Some doctors start with 25 milligrams daily, especially for older men or those more sensitive to medications. The goal is the lowest effective dose that gets your testosterone into a healthy range without side effects. After 6 to 8 weeks, blood work should be rechecked and the dose adjusted if needed. Some men do well on 25 milligrams every other day long term, others require 50 milligrams daily. This is highly individual, underscoring why medical supervision is non-negotiable. Now, let's address side effects because they are real and you need to know what to watch for. The most common is mood changes, increased irritability, emotional swings, especially in the first few weeks as hormones shift. This often stabilizes, but if it doesn't, talk to your doctor. Visual disturbances are another: blurry vision, halos, or floaters. If these occur, stop the medication immediately and contact your doctor. Usually it resolves, but never ignore vision changes. Hot flashes can happen too, similar to menopausal symptoms, because you're affecting estrogen signaling. They're bothersome, but typically not dangerous. Here's a side effect that surprises many: feeling worse despite higher testosterone numbers. How? Clomiphene can raise estrogen levels alongside testosterone because testosterone converts to estrogen via aromatase. If estrogen climbs too high, you might experience water retention, gynecomastia, breast tissue development, low libido despite high testosterone, and emotional sensitivity. This is why monitoring estradiol is critical. If estrogen is too high, your doctor might add a low-dose aromatase inhibitor or adjust your clomiphene dose. Hormones are a balancing act. What should you monitor while on clomiphene? Blood tests are essential. At minimum, check total testosterone, free testosterone, estradiol, LH, and FSH every 3 months, especially in the first year. Your doctor should also periodically monitor liver function. Track how you feel: energy, mood, sleep, libido, erectile function. These subjective markers matter as much as lab numbers. If your testosterone is high but you feel terrible, something needs adjustment. What about long-term safety? We have good data for up to 2 years, showing it's safe and well tolerated for most men in that period. Beyond 2 years, data is less robust. Some men have used it for 5 or 10 years without major issues, but large-scale, long-term studies are limited. This doesn't mean it's dangerous. It means we proceed with careful, regular monitoring. Responsible use means active management with your doctor, not a set-it-and-forget-it approach. All right, let's put this all together. I'm going to give you a complete checklist for discussing clomiphene with your doctor, a roadmap so you walk in informed and prepared. First, pre-treatment preparation, get baseline blood work, total and free testosterone, LH, FSH, estradiol, prolactin, liver function, complete blood count, lipid panel. Over 50% include PSA. These numbers tell you where you start and if clomiphene is appropriate. Next, what to discuss with your doctor. Be honest about all symptoms: fatigue, low libido, erectile dysfunction, mood changes, brain fog, muscle loss. Bring your blood work. Ask specifically about clomiphene and why it might or might not suit you. Review your full medical history: liver, heart, blood clots, vision, mental health. Discuss dosing, what they recommend starting with, how often and when. You'll recheck labs. Define what success looks like and the plan if clomiphene isn't effective. Now, the monitoring schedule, your safety and success plan. At 6 to 8 weeks, get follow-up blood tests for testosterone, estradiol, LH, and FSH. Your dose may be adjusted. At 3 months, do another full panel. By now, you should notice symptom improvement if it's working. After that, check every 3 to 6 months for the first year, then every 6 months if stable. Never go more than 6 months without checking levels. What lifestyle adjustments support clomiphene? This medication is a tool that works best with healthy habits. Prioritize sleep. Aim for 7 to 8 hours nightly when testosterone production peaks. Engage in resistance training. It amplifies the benefits of higher testosterone, helping build muscle and burn fat. Manage stress. Chronic stress elevates cortisol, which suppresses testosterone. Find what calms you, whether meditation, walking, or simply decompressing. Limit alcohol. It's toxic to testicles and lowers production. Eat a balanced diet with sufficient protein, healthy fats, and key micronutrients like zinc, magnesium, and vitamin D. Finally, know the red flags. Symptoms that mean stop clomiphene immediately and call your doctor. Vision changes, blurriness, floaters, halos, severe mood changes, intense depression, anxiety, rage, or suicidal thoughts, chest pain or signs of a blood clot, leg swelling, pain, warmth, or redness, severe abdominal pain, which could indicate liver issues, allergic reactions, rash, hives, difficulty breathing. These are rare but serious. Don't tough it out. Seek immediate medical attention. So there you have it. Clomiphene can be a powerful, affordable tool to naturally boost testosterone, improve energy, stabilize mood, enhance sleep, and restore sexual vitality. But it is not a magic pill. It requires medical supervision, proper monitoring, and a commitment to supporting your health with smart lifestyle choices. The truth is, it works very well for some men and less so for others. The only way to know if it's right for you is to have an honest conversation with a qualified doctor, get your blood work, and approach this intelligently. Knowledge is power, and now you have that knowledge. Before we finish, I'd appreciate it if you could do 3 things. First, if this video was helpful, please like it and subscribe to Medical Facts. We're building a community committed to living fully and healthily after 55. Second, drop a comment below. Tell me where you are in your health journey. Are you considering clomiphene? Have you tried it? What questions remain? I read your comments and use your feedback to create better content. And third, share this with a friend, brother, or father who might be struggling with low testosterone without knowing all his options. You could genuinely improve someone's life by passing on this information. Thank you for watching, and remember, the truth matters.